Good evening, ladies and gentlemen. It's an honor for me to be here today at the Elets Patient Centricity Summit and Awards, and I especially thank Dr. Ravi Gupta, CEO of Elets India, and the organizing team for inviting me here to deliver the keynote address. Thanks once again. Since this is a conference on patient centricity, I will focus my address on how diagnostics can become the foundation for universal healthcare in India and ensure quality healthcare services and affordable and accessible for all. Let us go to a remote village in India. A mother in that village walks a few kilometers carrying her child to reach the nearest doctor as the child has got very high fever. Thankfully, she meets a qualified MBBS doctor and not a quack who examines the child but cannot infer with certainty whether the child is suffering from typhoid or from malaria or dengue or chikungunya, or is it the beginning of hepatitis A, B or C or something else. He must order a few tests to correctly diagnose and treat the child. And rightly so, diagnostics are responsible for more than 70% of all clinical decisions in modern evidence-based medicine, guiding doctors from uncertainty to clarity and turning symptoms into diagnosis. If the diagnostics are not available in the village, then the quack or the rural medical practitioner, or RMP as we call them, would have given this child a gunshot 5C treatment. And this 5C treatment consists of a concoction of crocin, chloroquine, chloromycetin, cortisol, and of course, cold compresses. These are a cocktail of medicines which are given blindly to any person suffering from fever, even in sophisticated metropolitan towns like Delhi, Bombay, etc. In other words, the correct medicine is not being given and the cocktail is administered to bring down an array of fevers from different ailments. India's journey towards achieving universal healthcare is marked by significant strides but also with notable challenges. After all, there are 1.4 billion of us on this planet. One of the primary roadblocks remains the low public healthcare spending, which is marked at around 1.5 to 1.8% of our GDP. This allocation is amongst the lowest in the world and largely insufficient to meet the growing healthcare demands of the largest population on earth. Therefore, it is absolutely critical for the government to increase this healthcare spending to at least 2.5% of the GDP in the upcoming union budget, which should be tomorrow, which the government itself has committed. Such increased health spend would help strengthen health infrastructure and ensure availability of the required human and material resources at all levels of healthcare delivery. Key initiatives under the Ayushman Bharat, such as Pradhan Mantri Jan Arogya Yojana or ABPMJ, and Health and Wellness Centers or HWCs, now called Ayushman Arogya Mandirs, have been instrumental in transforming the healthcare landscape. The two programs were designed to work in unison to reduce the burden of diseases and improve early detection and management, aligning with the universal healthcare goals. PMJ has expanded access to secondary and tertiary care with hospitalization cover of 5 lakh rupees each for more than 50 crore beneficiaries. HWCs focus on primary healthcare, including population-level screening for non-communicable diseases or NCDs. These NCDs or lifestyle diseases pose a significant burden on the Indian healthcare system, with their prevalence rising rapidly. Last year, ICMR published estimates of prevalence of metabolic NCDs in India, which highlighted that 10 crore people are diabetic and over 13 crore are pre-diabetic. Therefore, it is no surprise that India is referred to as the diabetic capital of the world. About 31.5 crore people have hypertension, and 21 crore people have hypercholesterolemia, and 18.5 crore people have high LDL cholesterol, which is a bad cholesterol. Incidentally, NCDs account for nearly 65% of deaths and an annual GDP loss of nearly 2% in India. I would like to emphasize that NCDs can never be detected without diagnostic tests. I would like to draw your attention to how COVID-19 pandemic underscored the indisputable role of diagnostics in the healthcare continuum. The strategy of test, track, and treat demonstrated that timely and accurate testing is the cornerstone of effective disease management. It stands true for any communicable or non-communicable disease. Timely access to diagnostics not only improves health outcomes, but also significantly reduces healthcare costs by enabling early interventions and preventing complications. Strengthening diagnostic services, particularly at the primary care level, will be crucial to India's universal healthcare vision. By integrating diagnostics into all levels of care, we can build a robust and people-centered healthcare system, ensuring healthcare or healthier lives for everyone. Existing infrastructure for diagnostics in India comprises of government-run laboratories at all levels of healthcare, starting with primary health centers, community health centers, sub-district hospitals, district hospitals, and all government hospitals. Further, there are estimated 300,000 or 3 lakh private labs in India. Despite this extensive network, significant challenges persist in delivering accurate and reliable diagnostic services. Government laboratories are supposed to provide all tests listed in the National Essential Diagnostics List, also known as NEDL, to ensure affordable diagnostics, particularly in rural and underserved areas. However, the government labs face persistent supply chain challenges, shortages of essential reagents, equipment maintenance issues, delays in procurement, lack of quality controls, and the ever-present large number of vacancies of lab technicians and pathologists. A pilot should be launched in select districts to establish government-run smart labs, with the lab operations digitized with automated instruments, digital inventory management, and robust quality control systems. These labs will ensure timely procurement, regular equipment maintenance, and skill development for lab technicians and pathologists. By addressing existing challenges, these smart labs will serve as demonstration models for creating a scalable model for nationwide replication. The private sector dominates the diagnostic landscape, but quality remains a concern across both private and public facilities. Accreditation through NABL, which stands for National Accreditation Board for Laboratories or Testing Calibration Laboratories, is limited to under 1% of labs in India. And the Clinical Establishment Act, that is the CEA, intended to regulate standards, is not uniformly implemented across the states. This results in unchecked growth of small labs that run like testing shops, with no concern for quality of services, undermining patient trust and clinical outcomes. To eliminate non-credible laboratories from our healthcare system, we need to do two things. The first one is to undertake accreditation of labs in a target-based mission mode. For example, set a target of getting 2 lakh labs accredited over the next, say, 10 years. We will have to strengthen NABL and also create more accreditation bodies like NABL to accomplish this mammoth task. Number 2, while the accreditation is being undertaken, it will take some years to reach such large number of labs. The government must take the lead by strictly implementing the CEA, that is the Clinical Establishments Act, and making its adherence mandatory. So in other words, the CEA comes first and then comes the accreditation of the labs. Adding to the challenge is the acute shortage of qualified pathologists, particularly beyond the metros and big cities. There are only 8,000 qualified pathologists or MD pathologists in the country. This emphasizes the need for leveraging technology-enabled solutions like remote validation, which enables pathologists to monitor lab results across multiple locations without physically being present at all these locations, also known as telepathology. Government of India needs to formalize this immediately by releasing telepathology guidelines, as was done in the case of telemedicine during COVID-19. In the absence of such clear guidelines, we have faced absurd orders from states and districts demanding pathologists not only to be present in each lab, but the coup de grace was when one CMO issued a directive that a pathologist is to be placed at each collection center. At this point of time, I would like to inform this august audience that as a large diagnostic chain, Dr. Lal PathLabs alone operates more than 300 labs and 5,500 collection centers across the country. Diagnostics must latch onto the IT revolution in India. Way back in 1986, the first healthcare software in India, a lab management information software or LIMS, was developed by our lab, and it became a true game changer for our operations and now for more than 300 odd labs. And again, way back in 1999, we deployed the world's most prestigious G laboratory software known as Ultra, which gave us a bidirectional interface between the machine and the computers and provided connectivity with our remote labs and collection centers, enabling telepathology. The future of diagnostics in India lies in building an inclusive, technology-driven and prevention-oriented ecosystem to meet the country's diverse healthcare needs. A key focus must be on decentralizing diagnostic infrastructure to ensure access for underserved populations in Tier 3, Tier 4 towns and rural areas. Expanding diagnostics beyond urban areas will involve establishing a robust hub and spoke model, strengthening labs in Tier 2 and 3 cities, and deploying point-of-care testing for mass-scale screenings wherever applicable. Strengthening government-led diagnostic services under programs like Ayushman Bharat can complement private sector efforts in these areas. In fact, this private lab involvement in the government what we have mentioned can be a game changer provided it is utilized, because government does not have these kind of resources. Promoting preventive testing is essential, particularly in combating the rising burden of the non-communicable diseases or NCDs or lifestyle diseases like diabetes, hypertension, cardiac diseases, strokes, cancers, liver, kidney and lung disease. Routine screening programs supported by community outreach and awareness campaigns can encourage early diagnosis and timely intervention. Integrating preventive diagnostics into primary healthcare systems and incentivizing regular health checkups will help reduce the long-term disease burden and associated healthcare costs. Building a robust and inclusive diagnostic sector in India requires a synergistic effort between the government and the private sector. Both stakeholders play distinct but complementary roles. The government is critical in establishing a strong policy framework and ensuring its effective implementation. Increased public health spending, targeting at least 2.5% of the GDP, is essential for strengthening diagnostic infrastructure in government health facilities and labs, addressing supply chain challenges and incentivizing private sector participation in underserved areas are also things which should be done. The private sector will lead in driving innovation, scalability, and quality in diagnostics. They are also pivotal in developing new testing methods or lab-developed assays and digital solutions to empower individuals and support early disease detection. By ensuring quality services and investing in infrastructure in remote areas, private labs can complement government efforts and reduce healthcare inequities. True public-private partnerships will further accelerate innovation, expand reach, and promote a prevention-focused healthcare model in India. To conclude my address, I would like to take you all on another important aspect of diagnostics, and that is to consider diagnostics as a GDP driver. Diagnostic sector is very well poised to propel India to become the third largest economy by 2030. The Indian diagnostics industry is projected to reach 30 billion US dollars by FY30 or 2030. Further, the health sector is already the fourth largest employer in the country, and diagnostic sector has the potential to employ large number of skilled workers as lab technicians and phlebotomists who can be trained over a short period to become job ready and bread earners for the family. I have the pleasure to inform you that under the CSR initiative of Dr. Lal PathLabs, we have trained over 8,000 phlebotomists, with over 80% of them successfully placed in well-paid jobs. Last but the most impactful aspect of diagnostics is that it is a GDP driver and controls the onset of NCDs, and this alone can add up to 1.5 to 2% in our GDP. Therefore, ladies and gentlemen, let us collaborate to build a future where every Indian has timely access to quality diagnostics, paving the way for healthier lives, a stronger healthcare system, and a developed economy. Thank you very much.